Good morning, it's Paul Beauheart here on another chemo walk in Bangkok, Thailand. Today I kind of wanted to talk a little bit about getting healthcare in Thailand, Thai health system, specifically when you have cancer, but a lot of general knowledge there too, just about health in general. So the Thailand healthcare system, is it any good? Short answer, yeah, it's pretty decent. Thailand's, most famous for like food and hospitality. And the reason it's famous for hospitality is Thai people, are pretty good at dealing with different kinds of people, different kinds of situations, never losing their cool, always being concerned about the well-being of others. So those kind of traits that go a long way in the hospitality business, and cooking as well, that can kind of transfer over to the healthcare sector, where you obviously caring about people is important. Additionally, hold on, they're doing some heavy work over here. Hey guys. Additionally, the grandfather of His Majesty the King, Prince Mahidan, was a doctor. So King Rama IX's father, he was a king, or he was a doctor. He actually studied in the US. And so there's kind of being a doctor in Thailand is very high status. So a lot of the doctors you see in Thailand, it's like the best of the best, like the country's best and brightest. So instead of a lot of countries where the best and brightest might go into finance or something, a lot of the best and brightest go into healthcare here. So when you're dealing with a doctor, it's very well respected. So I've had a lot of experience. I've been in Thailand a while. So I've been to Thai hospitals for various things. Not just recently, the cancer, of course. Been there for other things. Food poisoning a couple times. Birth of my daughter. I got bit by a dog once. I had dengue fever. That sucked. Don't get dengue fever. It was rough. So I've been going to the Thai hospital for a while, and I'd say the care is pretty good. There's different kinds of care. You've got public and private. The public, so if you work in Thailand, you get what's called the Social Security Fund, and you pay like $25 a month, and your employer pays the other $25. And you get in kind of this big government program, and basically when something goes wrong with you, you can use this public healthcare system. Now, the public hospitals, they're not bad, but the thing is, usually you have to there's like a line. You gotta wait. If you need some kind of surgery, you gotta schedule it. It takes a while. And then there's private healthcare. In private healthcare, you're just paying with cash or with your own private insurance. Now, obviously, it's more expensive, but it's good. Like if you need something done, it'll just get done right away. So a lot of these hospitals, they'll have like a public side, and they'll also do the private side to make money. And the private side, you got to pay more, but you get like really good care, and you can get it right away, which is nice. So like I needed like a mole removed on my arm once. And they're like, well, you can use your Social Security Fund, or, you can pay like $300 and just get it done now. I was like, let's just get it done now, Let's splurge. So if you've got money, there is that option. But I would say the public, it's not bad. I know someone who actually had cancer like me, had breast cancer, and they were able to get it entirely paid for by the Social Security Fund. The only time they had to pay is when they wanted a private room. Usually when you're on the Social Security Fund and you go inpatient, you have to share a room with 5 other people. But they wanted a private room, so they paid a little extra. But the doctors and nurses at Thai hospitals are excellent. Very professional. My doctor, very competent. Knows what he's doing. Always knows what I should be doing. And I'd say I give the care a 10 out of 10. Hey guys.
Hello. Hello.
What's up, guys? Some youths there. So 10 out of 10 on the care. I'm fortunate to be here and be getting the chemotherapy. It's excellent. When I was diagnosed, I got into chemotherapy right away. I didn't have to wait. No queuing, just started the regimen right that day, basically. It started me off. But you do have to pay. All in all, for my 6 months of chemotherapy, so I'm doing a 6-cycle chemotherapy. I think it's 5-6 months. I think altogether it'll probably be, this is a ballpark figure, cost-wise, probably $20,000 to $30,000 out of pocket. It's no insurance, because my crappy insurance didn't cover it. It only covers when I go inpatient. And this was all outpatient, so I mean, it's a lot of money, but hey, it's better than the alternative, dying, you know. Beats dying. So out of pocket, that's about how much it costs in Thailand. This is in a private hospital. So when you're dealing with Thai doctors, and if you're a foreigner, you're gonna wanna go to some of these private hospitals. They're basically 5-star hotels. They've got Starbucks and, you know, little bakeries and stuff inside the hospital. So it's really nice. Samitawet, that's a really nice one. Down on Tong Law, there's Bumrangrat. That's on Soi 3, I think. And these are all the very big, very well-established private hospitals. They cater to wealthy Thais and foreign medical tourists. So you get a ton of medical tourists here from other Southeast Asian countries in the Middle East, and occasionally from the West too. So if you need some medical care done, you know, you can always come here for medical tourism. The government doesn't push medical tourism as much as other kinds of tourism, but I don't know. If I needed a procedure done, I would definitely just come here rather than the US. There's a big bumblebee. I hope I don't get stung. So the healthcare is quite good. I guess some of the criticisms. I'm gonna be gentle here on the criticisms, but one thing with the cancer, a lot of cancers, you need these kind of new treatments, newly approved procedures, and stuff takes a while to get approved here. Thai bureaucracy is notoriously a bit slow, so the Ministry of Health has to approve, much like the FDA has to approve these more advanced cancer procedures. For me, I have blood cancer, right? Multiple myeloma. So it's you have to get the autologous stem cell treatment, where they take your stem cells, treat you with chemo, and then put your stem cells back in your bone marrow. I think that's how that works. This procedure is only done at one hospital in Thailand. But in like the US, for instance, they do it all the time in like different hospitals. So it's like, if they're doing it more often at different hospitals, it's like the procedure will be more well established, less niche. So for that operation, I'm gonna try and get that done in the US. Get the VA to pay for it. There's another kind of like more, this one's called chimeric antigen receptor treatment or something, where they take your T cells and like engineer them in a lab or something. It's all very cyberpunk, and then put them back in your body and it like fights cancer cells. All very cyberpunk. All very cyberpunk. I don't know if that procedure is approved in Thailand, but they do it in the US. Maybe it's approved in Thailand, I'm not sure. But like the more advanced procedures, you don't see them as much here. They just take longer to approve. And I understand, I mean, these procedures, if they're done wrong, they'll kill the person, right? So there should be some kind of regulation. It's not like a new pair of shoes. There needs to be regulation on this stuff, obviously. I'm not like Mr. Libertarian about that. Another criticism, if you don't speak Thai, it can be difficult. If you don't speak Thai, I really don't recommend going to one of the public hospitals, because none of the nurses will speak much English. The doctors might speak a little English, like a little. You can go to like the private hospitals that cater to foreigners. They've got staff there that all they do is like translation. It's great. They like dress up in like kind of nice clothes and they follow you around. They do translation work. That's what you want. But you don't want to be like trying to explain some medical thing and the person like doesn't speak any English. You know, you could tell them something wrong and it would be bad. It's not like ordering the wrong thing of food, you just eat it, you know, like providing the wrong medical, providing your medical symptoms that, you know, that could like result in something bad happening. So if you do go to a hospital where they don't speak Thai, make sure you go with someone who speaks Thai, someone who can translate for you. Or you go to one of the nicer ones. That sure, they cost more, but they'll be able to speak English. So that's basically my only criticisms. The Thai staff, the medical profession in Thailand, it's actual like Thai people. They don't like import a bunch of people from other countries like they do in Dubai or something. They have to like import everyone. So they're all Thai. They care about, you know, the health, the general health of the country. It's good. And there's a certain like pride there, and so very high level of competence, very high level of care. I'm lucky to get my treatment done here. My doctor's great. So that's kind of my assessment of the Thai healthcare system. It's Paul Beauheart. If you want me to do more of these walk and talks, just let me know. Drop a comment. And I'm working on my cancer book. Throw up a hover card. Make sure to check it out. Should be out in April. Or you can go watch it on YouTube to see like it tail by tail. All right, we're getting close to traffic here. I got to cut the video off. It's going to be too noisy. As you can see, let's see, Red Road, very busy. All right, we'll see you guys next time. It's Paul Beauheart out.